Hey, I'm Dr. Brian McKay of Core Health. Thanks for tuning in today. Today we're going to be talking about a topic that's becoming more current lately, and that's called tennis elbow. Another name for tennis elbow is called lateral epicondylitis, but I don't expect you to remember that, so let's just keep it simple, and we're going to call it tennis elbow. Tennis elbow doesn't just afflict tennis players, it also affects golfers, but we're seeing more and more elbow pain as a result of people being on the computer, using the mouse, not proper postures when they sit, and what happens is it puts pressure on the muscles in the lower compartment of your arm. So there's a number of reasons you can get it, but basically if you have severe elbow pain, I can tell you what's really not working. It's mostly the cortisone shots these days, or the anti-inflammatories. They offer mild relief initially, but when the pain keeps coming back, it keeps coming back, you want to do something more serious about it. And the approach that we're taking here at Core Health is we use a couple of different therapies that we kind of just converge on the problem. The 4 different ways we go after tennis elbow is we use a adjusting technique called activator. We're allowed to move the radius, the ulna, and the humerus in the right position, taking pressure off the elbow joint, the elbow compartment. Now that we also follow what's called infrared therapy, which acts to dilate the tissue. So when the tissue is really tight and the tendons and the muscles get really tight, with the case of tennis elbow, we use the infrared therapy to dilate. Then we also go in and we do a soft tissue technique called Groston. And the Groston technique is one where we kind of strip the muscle away and reduce adhesions. Adhesions form in the muscle plane, and it's up to us to remove those adhesions to bring about healing. And the way adhesions typically work is if you took a pound of hamburger meat and put it in a Ziploc bag, the Ziploc bag is smooth. Well, the Ziploc represents the fascia. The hamburger meat is the muscle. Basically, it's similar tissue from a histological standpoint, but there are differences in how they appear because one's tighter and one dense. So what we do then is the tissue becomes more like a Ziploc bag loaded with hamburger meat. So there's more friction as the muscles and tendons move over each other, and it gets hotter and hotter and more friction and more adhesions come about. And another way I like you to think about adhesions are, think about a piece of bacon before it's cooked and a piece of bacon after it's cooked. The tissue is supposed to be like pre-cooked bacon, not post-cooked bacon. So what we'll do is we'll go in and use a special instrument, and we'll actually strip the muscles down. And it's a slightly discomforting process, but the good part is people usually see results almost on the first or second visit. Now, to cap it all off, we go ahead and we do some cold laser therapy, which emit photons, which you just think of as a packet of light energy into the cell to jumpstart the healing process. So the four-pronged process is one of the activator adjustment to take tension away from the radius, the ulna, and the humerus being the larger bone of the upper arm, radius and ulna, the 2 bones of the lower part of your arm. Then we go ahead and we follow infrared therapy, which is a painless process, make that clear, it's a painless process, followed by Groston, which is a soft tissue technique to really strip away the adhesions that form in a dysfunctional muscle. And then we go ahead and we use the cold laser therapy. So what I'm going to do is we have a patient right now who is a swimming instructor, and he's developed tennis elbow, not so much from tennis, but maybe he's got an improper stroke. We really can't tell as to why he has it, but I'm going to invite you back and go through the different procedures and explain them briefly and give you an idea of what we do at Core Health. Let's take you on back to show you our patient Jack. Come on back. Like I said, here's Jack. He's a swimming instructor. He's having elbow pain. Tennis elbow is the diagnosis. And what I'm going to do is I'm just going to kill the lights for a second so you can see the infrared therapy. The infrared, you can see the lights, and the lights act as a vasodilator. So it dilates, and we're dilating the whole arm. This part takes about 10-12 minutes. Passive, very passive. The patient just lies. He has no pain involved. Now, Jack has already been on this for about 10-12 minutes. So we're going to take this off, and then we're going to proceed to the next level of treatment, which is called we're going to use the activator adjuster to correct the location of the radius and the ulna. Just give us 1 second here. Now, what we'll do is we're correcting the radius, and we're going to come back here and work on the humerus. And a lot of times what we'll do is we'll find a complication down here in the wrist. So quite simply, very simple, we put the bone back into place, and there's a high level of comfort and a high level of effectiveness. Now, the next step we're going to do is called the Groston technique, and the Groston technique is one where we use a topical lubricant, and we bring that over the. There's a special stainless steel tool that we use. It has a very, it'll feel sharp. It's a very dull edge. And what we do is we come over here and we rub it over the elbow compartment, and we work the adhesions out. You can feel the adhesions and almost even hear them. But what happens is, like, think of popping those the bags that the shipping stuff comes in. That's almost what we're trying to do here, is trying to erase those adhesions that form in the muscle body itself and also in the tendon. And now we're doing this for demonstration purpose, but typically this part takes about 10-12 minutes also. So what we'll do here is we'll, you can see, very simple, but this is the third part of the four-pronged approach that we use to treating tennis elbow. And now I'm just going to bring them up. Now the final part is going to be one where we're going to go dark. Okay, we're going to go dark, and we're going to use the cold laser therapy. Alright, for that I'm going to shut the lights off again so you get a better look. And Jack, you can see right here, I'm actually going to, you may see 3 lights, and again, this we call this a class 4 cold laser therapy. And as you can see, there's not a lot of discomfort with it, but this is a very effective treatment. The light actually stimulates growth of new cells. Basically, with the last technique, the Groston technique, we were putting the cells off and trying to erase them. So this is a nice way to end the treatment, and this basically allows for the greatest success in treating tennis elbow. Alright, I'd like to thank you, Dr. Brian McKay, Core Health Darien, and you can reach us if you have a problem with tennis elbow. Please feel free to give us a call. We see a lot of success, and hopefully we get success for you. Thank you very much. I'll put the light back on.